Hi, it's Leslie Schmidt. I'm going to go ahead and start performing basic first aid in a small animal. The first task we will do is caring for fractures. And the first thing we do when we have a patient that has a fracture is we need to place a muzzle. We did watch the video on how to perform first aid in animals before we began this video as well. So I'm going to go ahead and muzzle my patient. With her unusual shape, I'm using tie gauze. If it were a dog or cat, you could place a proper muzzle usually. Okay, so I just tied around her muzzle here. I'm going to go behind her head and make a tie, and that will create a muzzle. I do have a modified stretcher I'm using for her, which is the towel that she's laying on. We can move her from place to place with this. It doesn't have to be a rigid stretcher in this simulation. So we go ahead and lay her on her side, and we're going to place a modified splint on her leg that has the fracture. Obviously you want to be very careful. They're going to be painful, and hopefully some pain meds are going to be administered before this process begins. So we'll start by using a primary layer. That would be gauze if we had any open wounds. So we place gauze on there. We're going to use the secondary layer, which is the padding layer, to help keep her from bumping that. And we'll just go ahead and wrap that. And this is a very simple splint. Most of the time doctors are going to be the people that will actually place splints. Technicians can do basic splint placement, but doctors would be the ones who are obviously the most qualified. And here's our tertiary layer, which is the vet wrap. That will keep everything together on there and keep it from getting wet through the other layers. Okay, so that is basic first aid and fracture care.
Okay, now I'm going to discuss caring for an animal that has a bleeding wound.
The first thing I want to do with my patient is go ahead and muzzle her. I'm going to use the tie gauze because she is oddly shaped, as I mentioned before. So a lot of times when an animal has an open bleeding wound, they can be painful. So just always keep that in mind. No matter how calm they are, they can still bite us. So we'll go ahead and muzzle. And we're going to say again that she has a wound on the right front leg. So I'm going to gently roll her over and go ahead and get access to the bleeding. I would want to stop it as quickly as I could with just applying simple pressure to the wound. She has a wound right here. I'm going to go ahead and apply pressure. And instead of checking the wound often to see if it's done bleeding, I need to just apply direct pressure for 3 minutes. And hopefully that would stop the bleeding. There is another way to stop bleeding also. That would be we could actually place a permanent bandage over the spot that's bleeding. And if we were going to do that, we would actually apply a non-stick surface first. So I don't want any of this gauze to stick to my wound. So I would apply this first, obviously open the package and apply that to the wound, going ahead and wrap it with some vet wrap. We could do it that way, just as a temporary, until we have the doctor come over and take care of the wound. There is another manner in which bleeding can be stopped, and you can actually use a tourniquet. Tourniquets should be used as a last resort. They can cause damage if they stay on too long. So what we would do is we would apply a tourniquet above the bleeding. So I'm going to go ahead and apply a tourniquet to the leg. So I'm going to tighten that down. And if we use this, of course, we're still going to have probably some type of a dressing on top of it too. If we're having that much bleeding, we want to make sure we have something on it. And if you use a tourniquet, it has to be loosened every 15 to 20 minutes for 20 seconds. So we just spoke about external bleeding. I want to talk about internal now. You want to assess your patient for many things to see if they're possibly bleeding internally. You could see a nosebleed, you could see bleeding from any orifice on the head, even the eyes or the ears. As far as within the body, you might see the animal coughing up blood. You may see blood in their urine. You might see a distended abdomen. You see pale mucous membranes. The animal would be very weak and probably in a collapsing state, and they would have a rapid pulse. You might even also see bleeding from the rectum. The best thing to do for an animal that is probably internally bleeding is to keep them warm and quiet until they're assessed by the veterinarian promptly. If my patient is experiencing chemical burns, the first thing we would want to do is muzzle our patient. So we're going to set her up carefully and muzzle her. And if it's a mild burn, there would be a difference between caring for that and a severe burn. We'll go over the mild burn first. We're going to muzzle her. So we're getting the tie gauze on her patient. So we're going to go over the nose, behind and around. So she's muzzled. They can be painful when they're burned. It's not something we see often. but we do prepare for the worst as far as their pain level. So we're going to lay her down, and if it's a minor burn, we're going to go ahead and flush it immediately with large quantities of water. If it is a severe burn, the animal does again have to be muzzled, even more so now. There's even more pain involved. And what we would do is we would quickly apply a cold compress to the leg. You can use ice water compress to the burn. You have to be just very, very careful. A light amount of pressure with a lot of cold. Next, we're going to talk about caring for our choking animal. We did watch the video on performing the Heimlich maneuver, so we're going to discuss doing it on a small animal and a large animal. The first thing you're going to do is look for signs of choking, which would be pawing at the mouth, licking, smacking, gagging, coughing, blue mucous membranes. You can hear a constricted airway, a little wheezing, and just difficulty passing air. So if you've assessed that your patient is choking, the first thing you need to do is make sure the airway's clear. So grab their face really gently but quickly and just look down in there and see if you can see any foreign objects. If you can, very quickly grab a pair of hemostats. If you are safe to go into the mouth, extract the foreign body as soon as possible. And then wait for the animal to return to a normal state of breathing. If the animal still needs help, you're going to actually perform the Heimlich maneuver. With a small animal, what you're going to do is come down, you're going to palpate the ribs, and where the ribs and the abdomen meet is where you're going to start your compression or your forceful pushing of the air upward into their lungs. You're basically causing them to take a rapid, sharp breathing fashion that's going to force any object out of the mouth. You can actually pick up your small animals and perform that action and kind of tilt them a little bit and let gravity help you. So you can do that. You can even give them a little shake or swing and a very, very slight shake while you're performing that. You got to be really careful. You do have to be forceful, but you need to be careful. So I'm performing that action where the rib cage ends and the abdomen begins. For a large animal, they could be standing if they're able to stand, and you can perform the same manner. You know, open the jaws, clear the mouth. If you don't see any foreign objects, you're going to go ahead and start the Heimlich. So you would feel again for the ribs and where the ribs and abdomen meet, and you're going to go ahead and perform that action. You can use your hand to stabilize the top of the back and then just perform the pinching upward action, you know, pressing up into their lungs using the abdomen as your pressing point. And once your animal's breathing again, they still need to be assessed by the doctor. So never forget to tell a patient's owner if you're instructing them to do this at home that they need to have their animal looked at. There could be, depending on the kind of foreign body they have, they could have some damage that needs to be assessed by a veterinarian. Next, we're going to care for a patient that has heat stroke. The first thing to do would be to place a cool or cold towel, a wet towel, around the neck and the head. And do not cover the eyes, mouth, or nose. We can remove the towel and re-wet it with cool water and refresh it often. You should be checking it to make sure that it's not heating up and getting really warm. You don't want a warm towel on a hot patient. So just periodically refresh it and make sure that it stays cool. We can use water, and you can either use a hose or some table that has a wet hose. In this demonstration, I'm going to use water in a bottle, but you need to have a more constant water source that you can use to run it all over the animal's body to keep them cool. We're just going to use cool water, but not freezing. It needs to be kind of a moderately cool. We don't want to shock them by cooling them down too quickly. So it would be irrigating across the animal's body, paying close attention to the abdomen and between the legs, because that place does hold and radiate a lot of heat. We would keep that going until we have cooled the animal to the point of at least 103.5. Then we can stop the cooling measures because we don't want to take them down too quickly. We want to go ahead, and if we have a very wet patient, we're going to dry them off so their body temperature doesn't drop too rapidly, and then get the patient to be assessed by the vet as soon as possible. If I have a patient that is in shock, there are a couple things that I will need to instruct the owner on if I'm talking to someone over the phone. There are two stages. Obviously, there's the compensatory, where the animal can appear to be fine. We need to talk about some of the things that they'll experience when they're in compensatory shock. They can appear to be looking well. They may be a little quiet, but we'll go over a couple of the vital signs that we'll see with a compensatory shock patient. They'll have a normal heart rate, which can be a little elevated. Their skin and rectal temperature will be normal. They will have normal respirations, maybe a little bit elevation there. Their pulse can be normal, but it can be a little bounding, like there will be a little bit of a pounding heart. Their mucous membranes will be strangely red. That is completely unique. That would tell you there's something wrong. You don't see red membranes very often.
They'll also have a rapid refill time when you go in and check their gums. It's going to blanch and then fill up almost immediately. You'll probably maybe have a hard time counting the time. Their urine output will be normal. They'll have alert mentation, but they might be a little quiet, like I said. And if they have any hemorrhage, any bleeding anywhere, it may be slight or it might not be present at all, depending on what kind of shock they have. If we have a patient that is unfortunately in decompensatory shock, we will see something quite different. If you were to describe it to an owner, you would say, well, does the animal have a weak pulse or shallow breathing? Does he just seem nervous and listless? He could possibly be in decompensatory shock, especially if he's experienced some kind of severe injury or a frightful episode. They can go into shock. The best thing to tell them to do is keep their animal restrained, warm, and quiet. And what we would see here when the animal finally got to the vet, we would see quite a different thing than our compensatory stage. We would see an animal that is mentally very depressed, weak, could possibly almost be unconscious depending on how severe it is. Their rectal temperature would be down. They would actually feel cold all over. They would have a rapid heart rate with a weak and thready pulse. Their femoral pulses may actually be absent. Their mucous membranes would be quite different. They wouldn't be red as in the compensatory stage. They would be white to pale, and you would have a hard time finding the CRT on them. It may take quite a long time to refill, or it could even be absent. The most notable thing that they'll have with shock is a very low blood pressure. It's probably indicative of some type of a bleeding somewhere, profuse bleeding. So they do need to see their vet as soon as possible and be put on IV fluids and receive steroids. If their animal has become unconscious, they do need to keep the head level with the rest of the body. Next, we'll talk about poisons. Animals are exposed to many things in our home, whether it be cleaning products, rodenticides. Chocolate is a poison to an animal. Some of the foods that we eat, normal foods like grapes and onions and avocados, even sugar-free gum. So you've got to be aware that some people don't know that, and there are some astute owners that do. When they call us and say they have an animal that they believe has been exposed to something toxic to them, we need to be sure to tell them we need the packaging. We need to know what the actual active ingredient is of that product. It's very important that we know that. Sometimes when you have that package, there are some care instructions on there as far as how to, course care for a human. Sometimes we can get lucky and find information on what to do if a pet has been exposed to that particular toxin. Well, probably about 50% of the time that happens. Usually what we have to do is call the Alabama Poison Control Center. It used to be a free service to us, but isn't now. They do have to pay about $50 to speak to Poison Control, but that is the best way to go, especially if it is a toxin that we are really not that familiar with. They have certainly a vast database of adverse reactions to anything that's toxic to an animal. They will not only give you all of the adverse reactions and what to look for, they'll also give you a treatment plan. So the best thing to do is to tell them there are some things we can do at home to start the process of ridding their pet of toxins. We can induce vomiting at home sometimes depending on the toxin. We do usually recommend that they do that right away, and they still need to be seen depending on what they've been exposed to. When they call poison control, they have to have a lot of specifics about their pet. They need to have the species, breed, sex, weight, number of animals involved. They need to have symptoms. They need to be able to describe the symptoms and the time of exposure and how much they have eaten possibly. Of course, they have to have the package with the active ingredient, and they need to bring the rest of the package with them when they come to the veterinarian. When we talk about inducing vomiting at home, if the veterinarian advises that is safe, we can. We usually recommend using 3% hydrogen peroxide, and it is a teaspoon per 5 pounds, but we do not want to exceed 3 tablespoons or 45 milliliters. The vomiting will usually occur within minutes, and it can be repeated every 5 to 10 minutes initially if it's not successful. The only time we would not want to induce vomiting is if the patient does not look well, if they are very, very ill, if they're to the point of where they're almost unconscious, they're extremely weak, or if they're having any type of a breathing problem. We don't want to cause them to aspirate anything. If they have swallowed anything very caustic to their airways, we don't want to have that come back up through the stomach. And those would be reasons why we would not want to go ahead and induce vomiting at home. If I have a patient that is experiencing a seizure when an owner calls, there are a couple things we need to talk about. We need to tell them if it is quite a violent seizure that they don't need to try to restrain their animal. They need to move them away from anything harmful that could hurt them and just kind of wait for the seizure to pass. Most seizures will happen for a short duration and stop. If they are continuing to seizure for quite a while, there's quite a substantial problem usually involved. It's not just a seizure disorder, there's something else going on. But they need to actually keep time of the seizure and monitor everything that the animal's doing while they have the seizure, every behavior they're having. So you're going to have to ask quite a few questions to really accurately describe what kind of a seizure their animal's having. They can be very mild or very severe. And after the seizure stops, we want to tell them, usually that's the time that we talk to them is after they've stopped. Sometimes they'll call mid-seizure and ask what to do. The best thing to do is go ahead and get them to their vet immediately. When they're on their way to the vet, they need to keep them as warm and as quiet as possible. If they can possibly cover their eyes to shield them from any light, keep the noise level down because that can stimulate another seizure or certainly keep the one that they're having going on or prolonged.